Thank you. Thank you, Diego. And if everyone will find their little globe. Okay, let's go ahead and begin. We have a couple of people with us to do the Public Health Accreditation Board, the reaccreditation application process. And Myra Shanks and Kara Casterline, you're going to do the presentation. Kara, I believe you're going first. Is that right?
Yes, so I will be doing the presentation today, and Myra will be supporting as needed if there's questions. So
great, thank you both.
So are we ready to get started? Okay, perfect. Good afternoon, everyone. My name is Kara Casterline. As the accreditation coordinator for Jefferson County Public Health, it's my job to make sure that we are really telling and documenting JCPH's story in a way that meets national standards. So with that being said, today I'll be talking to you about the Public Health Accreditation Board reaccreditation application process. This presentation hopefully will be a refresher on the Public Health Accreditation Board, which I'll be referring to FAB going forward since it's pretty wordy. And it will provide an update on the health department's reaccreditation process and preview what's to come in today's board meeting. This board plays a critical role in that reaccreditation process, and the session will clarify that role and why it matters. Also, you may know that there will be an item on today's agenda with a formal request for your support. So I know it's been a while since accreditation was discussed with this board, and many of you are new. We're so proud that JCPH was accredited in 2019. Basically, this means that we received a seal of approval for our performance against a set of national standards. Some of you were along for that journey, and you may recall that it was a lot of work, and you might also be asking why we would want to go through that again. While reaccreditation will allow us to keep our status by confirming that we still meet the requirements, more importantly, it's an opportunity to showcase JCPH's commitment to evolving, improving, and basically striving for excellence in our work. As I mentioned, there's initial accreditation and reaccreditation. What's the difference? Accreditation basically checks the box that JCPH delivers the 10 essential public health services. Hopefully this wheel showing those 10 services is familiar. I believe Dr. Story was going to share it, but I'm happy to share it out if you need a copy. So as I was saying, we got that initial gold star. The first time relies heavily on documentation and checking the box. Now coming up, and 5 years later, we need to demonstrate that we are still doing these things and becoming increasingly effective. And we're doing this by telling JCPH's story. Pursuing reaccreditation is our commitment to getting better. Backing up a little bit about FAB. It's a national nonprofit that sets measures for health departments that are striving to get better. FAB is non-governmental, so it's removed from politics, and it's standard across the country, which is really nice. Our relationship with FAB is reciprocal, so it's an important part of the public health family. What I mean by that is not only do we demonstrate through our work that we meet FAB standards, but we can also help to inspire and influence change at the national level by being partners with FAB. And retaining our accredited status just strengthens this relationship. So what does the reaccreditation application entail? Domains are broad, overarching concepts. For example, one is communicating effectively to inform and educate people about health. Within each domain are best practices to demonstrate called standards. For example, under the communicating effectively umbrella, a standard is to provide information through a variety of methods and using strategies to support prevention. There are very many ways to measure those standards, and this is done through measures that we provide documentation for. So this would be like what processes we use in non-emergency communications, for example. How are we doing this? We are so lucky to have the people who do the actual work be involved in the process of building our application. For each measure, a JCPH member has taken the lead on documenting our work. That means there are people all over the organization helping to demonstrate how we meet the 57 ways that FAB measures excellence. So there are 57 measures in the application that we document. I want to take this opportunity to really call out just how much of a group effort this has been. Specifically, 42 individuals have gone above and beyond their daily work to provide documentation in creating a strong application by acting as a measure lead, a member of the review team, or a member of the senior leadership team. This number doesn't even include the very large amount of staff who supported this effort by collecting documentation, doing the work, and being a part of helping to tell JCPH's story in a meaningful way. Here's a snapshot of the project timeline. The senior leadership team moved forward to seek reaccreditation in April of 2022. Fast forward to about a year and a half later, we are in the final steps of completing a strong application. In this relatively short timeline, gaps were identified and work was done to fill them. For example, in the initial scan, a workforce development plan was identified as an area of weakness. This drove us to work with a consulting group to create and prepare to implement one. So as of this meeting, you'll be happy to know that so far, all documentation has been submitted and reviewed by the review team. The senior leadership team is in the process of their review, which we expect to wrap up in a couple of weeks. So that's where we're at. What's next? Today, we're here to provide a status update to this group. As I mentioned, the board plays an essential role in this process, and your support is so important to us. Again, we will be formalizing a request for your support at today's meeting. All goes well, we intend to submit our application early 2024. It will open in January, and we will have until March to hit the submit button. We anticipate a site visit from FAB before receiving their final decision and estimate that will come in the middle of next year. I really appreciate the opportunity to share with you today. I'd like to open it up to questions and discussions or any follow-up.
Thank you, Kara. Myra, did you have anything that you wanted to add?
I didn't have any items to add. Kara has really been kind of the central player in coordinating this effort. But happy to help field questions. I do want to just echo what Kara said, that it's been a pretty significant team effort across the organization. So thanks to all of our measure leads and other folks who've been involved in the project, to all of our staff who are on the call today.
That's great. Questions from the board members? Comments? Dr. Hall, you have your hand up. You're on mute.
So I have a question. And my question has to do with whether there's a role for the board, or whether there are accreditation standards that relate to the board, and whether the board would have any role when the accreditation folks do their site visit.
That's a great question. I will attempt to answer, but think Jody and other members of the senior leadership team who've been through it before might be able to weigh in more. So basically, from a requirement standpoint, the role of the board is just to approve our application. So that's all that FAB requires. I think that there's room for like when the site visit comes up, we'll definitely be keeping this group in the loop. And if you want to participate, we're definitely open to that and could talk about it more. In terms of a requirement, I don't think that there are standards. So if there's interest in participating, we would definitely welcome that, but you're not required.
That is the same process, I think, that we had last time. Lane, I think you were also here last time and you also have your hand up. Go ahead.
Thanks. And thanks for all the work on this. Carrie, I kind of had similar questions. It was related to the site visit. I remember the last time we were accredited, there was either some feedback on the board having more involvement, but I don't remember the particulars. So wanted to make sure we are fulfilling those areas that they had listed last time. And I can't remember if we did meet with them. I know we met as a group, but I can't remember if that was with the FAB staff when they came. But if we are, just wanting to make sure we are prepared and if that's a role you would like the board to play.
Myra.
Yeah, thanks for the question. And to build off of that, I think that during the site visit, my understanding through the process, not having been directly involved in a site visit process with FAB before, so anyone who on the senior leadership team who might have some feedback about what the process was like historically. But the site visitors usually prepare by reviewing all the documentation ahead of time and requesting meetings and kind of helping to guide who they want to be having additional conversations with. So we get some kind of initial feedback from the site visitor team to understand who we should be kind of pulling together and ensuring are part of that site visit process. And then in terms of measures that connect to the board, there are a couple measures that do request our organization set some standards for how we report information to the Board of Health. So there's a bit of language in one of the measures around the strategic plan for the organization and how we report and share information about our strategic plan. So there's a couple, but the onus is really more on how we engage with the Board of Health rather than how they called it the governing entity, how there's not a lot of specific requirements for how the Board of Health, there's not measures that y'all have to meet. It's mostly a matter of requiring specific standards for how we interact and report out information to y'all.
Thank you. Are there more questions from the board members?
I will just add, thanks, Myra, for that information. And Lane, as we prepare for the site visit, we will be definitely looking at the feedback we received last time. So if there was something that called out, participating with the board or anything like that, we will definitely address it. We just haven't gotten to that step yet. We'll start that project after we get our application in.
Thank you, Kara. So what is the next step? I believe, Kara, you said that you needed the board to give their approval to move on with the process. Is that the next step?
The next step will be that at today's agenda, there is an item that formally asks for your support, and we have a drafted letter that goes along with that. So that'll be the next step, and that's one of the final steps. We're tying up loose ends with, as I mentioned, senior leadership review, and we hope to have the application packaged by the end of the year.
Okay.
Thank you, everyone. Here's my contact info if you have any other questions that come up, comments, feedback. We're all ears. So thank you for your time, and I hope everyone has a happy Thanksgiving.
Well, thank you for you all and all of the participation that everyone has given to this. It's really taken a lot of work. Sarah, you have your hand up. Sarah L, we're going to call you.
That's great. Yeah. I want to echo some gratitude. I know it's a significant amount of work to get all of this documentation ready, and big celebration to getting it submitted. And I hate to ask this question, but I'm also going to ask, as soon as you get it done, you're going to have to turn around and start preparing for the next. What are you most excited about that could be spaces for kind of growth and innovation as you move into the next round for accreditation?
That is a great question and a good point. It is like, it does seem like there's a finish line, but there's also like, okay, right after we finish that, we're prepping for not only our annual reports, but for our next reaccreditation. So this process has highlighted a lot of areas in which we're doing really well and areas that we want to continue to improve in. I'm thinking like performance management, workforce development, things like that. So I think that we've really had some tangible ideas come out of this process that we're excited to implement. And in terms of the application process, I think that next time around, we're hoping to make it a little more standard and a little less intensive for those who are involved, because as I mentioned, it's the people working on this, it's above their daily responsibilities. So we want to make that as smooth as possible. So we're hoping to have some processes in place so that when the application comes around, we'll have to, make updates and things like that, but it won't be, rebuilding the wheel.
Thank you. And thank you, Sarah. Those are great comments. Did you have another?
I do have another question.
Okay, I couldn't tell if it went off or went on.
Sorry, I probably should have asked this before you were trying to conclude.
You're fine. Thank you.
So, I mean, I think in Colorado, Jeffco is one of several, but not all, of our local public health agencies who are accredited. What kind of benefits do you think you're seeing out of the accreditation process for you as a local public health agency that maybe sets you apart from those who are not accredited?
That's another really good question. I think that it's a good benchmark on how we deliver services. So it's one thing to say, like, we're really good in this area, we're not so great in this area, we can do better. But to have a third party like holding us accountable and measuring us against, across the country, it gives us specific feedback that we could implement. And I think that just in terms of providing services and like public, I don't want to say public opinion, but kind of it's backs up what we do in a specific way. So, you can talk the talk, but we could kind of also back it up and say, we have a gold star from this recognized, respected body.
To follow up on that, does that open up, I know it wouldn't be required for someone for an accreditation, but does it give us kind of a plus when we're looking at trying to get funding of any sort, outside funding of any sort? Do they look at that at all?
So I'm not going to speak to the specifics, but I think that I see Christine has her hand up and Dr. Story, so they might be able to add it, but I don't think that it hurts our case when we're applying for grant funding.
Dr. Story.
Christine was first.
Christine. Sorry, Christine.
Christine says, and then I'll say what she said.
You're up in my far corner to my left. I didn't even see you.
Oh, you're fine.
Please go ahead, Christine.
Yeah, in support of the team, and to answer Sarah L's question, I did want to say that we do put into every grant application that we are an accredited institution. So the success rate of those grants, it's hard to measure whether, you know, being an accredited public health agency or not leads to the positive success. It is a hard world right now to get grants to support the work that we are doing, but it is certainly mentioned in every grant application that we would submit. And I would say too that it gives us a shared platform. So in being able to share with counterparts across the state who are accredited and across the nation. So we are able to speak the same language and share best practices. So there is a bonus to be had, you know, in addition to the positive nature of being an accredited institution.
Yeah, thank you. Dr. Story.
Yeah, I'm building on that a little bit, which was actually where my mind always goes with FAB and PHNCI, which is like the innovation. I call it fancy. They don't like when you do that, but that's truly what the acronym spells out. So PHNCI does, you know, things like invite-only innovation summits with like 100 health directors from accredited health departments, where you're in rooms with tech CEOs and folks who are doing like really, really innovative work, and you can't get there unless you know, have that gold seal. To me, the most important thing and why I believe in accreditation is because it gets you into the standard making. I see it actually the most important thing is that it gives us some validity to say the actual gold standard should be this. Like, this is where we exceed. This is where we go above and beyond. And I remember years ago, like a decade ago, you know, FAB wouldn't let you submit websites as an example documentation. You had to print out a website and put it in a binder, right? And all of these folks were like, but we do interactive dashboards, we do storytelling, we do, you know, photo voice, and all of these beautiful projects that were pushing the boundaries, and then FAB adapted. But again, you can't sit at that table unless you have the accreditation. And just to be real, losing accreditation is worse than never having it at all. And many states are moving towards a mandated accreditation model. I know Kentucky's one of those states where they require all their LPHAs to do it. And I don't think that's far away for us in the future. I know that our rural and like frontier counties, it would be nearly impossible. They have 2-3 FTEs. There are separate standards for those folks, but it's still, the documentation is so heavy that, you know, they're better off maybe just sitting it out for a while until it becomes easier. So I think if we were to not be accredited at the size we are, with the budget we have and the number of FTEs, people would wonder why we didn't get it or why we lost it. And so these, I mean, the folks working on this, I mean, just, it's above and beyond, and it is so much work, and I will do everything in my power to make sure it is easier the next go around, and that it will become more of our everyday work instead of this peaks and valleys work we're doing every few years, you know. So thank you just from me and from all of SLT, and a big special shout out to Jody, who's actually like spent hours over the last few weeks reading every part of the application. So God bless. He can probably hear me yelling this. He's, you know, 2 offices down. That is a lot of work too. So I just have to give him a special set of props for that, because that's not easy either. So.
Thank you. But it was actually made easy by those 42 people that gave me very little to recommend edits on or to pick apart in the entire application. So yeah, just great kudos to a lot of very thoughtful and thorough people inside this organization.
Thank you. And thank you, Jody, for all the work that you did put in on this. Okay, are there any other comments or questions? We will, under new business, I think you all received a copy of the letter that we would put forth, and that's where we'll vote on moving the letter. I mean, accepting the letter. And if there's no other questions, we can move forward. It's just now 4 o'clock. Good job. Thank you so much, Kara and Myra.
Thank you.
A lot of work to all the 42 people out there. Okay. And it is 4 o'clock, so we can go ahead and call the business portion of this meeting to order. We will go ahead and obviously keep our language justice folks on. They've already signed in and done everything that they need to do. We will need to take roll call. So Lindsay, can I get a roll call?
Sure. Sarah Lampe,
Here.
Harriet Hall,
Here.
Lane Drager,
Present.
Sherry Jean,
Here.
and for the record, Rochelle Woods is absent and a quorum has been established. Thank you.
Thank you, Lindsay. Okay, very first thing on our agenda of the business meeting is the consent agenda. As you looked through it, is there anything that anyone wanted to remove from the consent agenda that needed more conversation and discussion? If it is nothing that needs to be removed, maybe please get a motion to approve the consent agenda.
I would move that we approve the consent agenda.
We have a motion to approve. Do we have a second, please? It's been seconded by Lane. Any further discussion? Okay, all those in favor, please say aye.
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 Any opposed? Hearing none, that motion passes and the consent agenda is approved. The public comment. We don't have anyone signed up today, as we would like to remind everyone that we do like to hear from the public. We like to have them attend when they feel like there's something that they want to share. It's not a time that we do back and forth dialogue. It is a time that the board listens to the comments, and when it's appropriate and needed, then of course we would turn it over to a staff member to get back to that person, or if a board member needs to get back to that person. Moving into the financial report. Salma, are you getting some sleep these days? Salma has a new baby.
Yes.
Well, I guess she's not like new now, but
She is sleeping through the night.
yay.
So yes.
Okay, please go
All
ahead with
right.
the financial report.
Let me share my screen. Can everyone see my screen?
Well, sort of.
Sort of. Okay. Let me
It's
see.
pretty small.
How about now? Better?
It is better. Can everyone
Yep.
else see that?
Yep, looks good.
Okay, thank you.
Well, hello everyone. Today I will be presenting the October financial statements. And as of this reporting period, with 83% of the year complete, our total revenues are being reported at 74% of the annual budget. And this is below, and our revenues are below budget by 9%. And this is primarily due to our grant funding, as we were not able to utilize our ELC grant. And I know someone asked me last time about what ELC stands for. It's Epidemiology and Laboratory Capacity Grant, which is our COVID response award. Unfortunately, we were not able to utilize $2 million of that award, primarily due to the fact that we are phasing out of COVID response to recovery, and also due to the funder limitation of what we can use those funds for. In terms of our expenditures, they are being reported at 75% of the annual budget, and that variance is also primarily due to the ELC grant. We are not filling the vacant positions as a result of shifting to the recovery phase. And also we've moved a large portion of the ELC salaries and benefits to the county ARPA grant, which is the American Rescue Plan Act grant. So those figures are no longer reported under public health fund, and they are shifted to the county fund. Our supplies are being reported currently at 232% of the annual budget. We did shift capital projects and equipment budget, almost 90% of that budget, to this line item to cover computer equipment. We did not have any capital structure to update this year. Other charges and services are being reported at 81% of the annual budget. We are slightly over the direct assistant line item, and intergovernmental and interdepartmental charges are both being reported at 86% of the annual budget. In terms of the next item on the agenda, which is forecasting and county transfer, we are projecting that we would fully utilize our county transfer funds, although we are reporting 78% of the annual budget with 83% of the year complete. That 5% variance, or approximately $620,000, are being reserved to cover an additional pay period of salaries and benefits that is expected to hit in December. So we are not projecting to have any funds remaining, and we are on board to spend down our county transfer. That's all I have for today, unless if you have any questions.
Are there questions from board members? I am not seeing any hands. Okay, well, Salma, as always, thank you for your work and thank you for a good presentation.
Thank you.
If there are no other questions, can we get a motion to approve the financials, please?
Motion to approve the financials.
There's a motion
Second.
to approve, and it has been seconded by Harriet Hall. Is there any further discussion before we take the vote? Okay. All those in favor, please say aye.
Aye.
Aye. Any opposed? Please say no. Hearing none, seeing none, that motion passes and the financial has been moved forward, but we are going to hear from Joe, I believe. Is that right, Joe? For the end of the year forecasting?
So I just actually covered that in terms of county transfer, and that we should
Oh, he
be on
doesn't have
track with
anything.
utilizing.
Okay.
Yeah.
Nothing to add, Joe?
Unless there's any questions about year-end
Okay.
utilization of the county transfer, I think Salma's covered the basics. So any
All right.
questions, happy to assist.
Okay. Well, she had you down here, so I said I better check in with Joe.
Thank you for checking, Sherry.
Okay, we are now into the new business. We want the board to review and approve the FAB reaccreditation support letter. All of you received a copy in your packet. Have you had a chance to review it? Are there any changes, comments, questions? Harriet, do I see a hand?
I couldn't find the right,
Your hand
right
works.
click for
Your
my
hand works.
raising my hand. So I
That'll do.
wonder if we might want to add a paragraph or a sentence at the end of the letter thanking our staff for the hard work that they've put in preparing for the accreditation process.
Well, I see no reason in the world that we couldn't do that. It certainly is warranted.
Yeah, that's what I was
Is there
thinking.
further discussion, or is there comments from the other board members that you would like to see that done? Okay, that was a thumbs up. So we're all giving it a thumbs up that we'll add that. Would you make a note of that, Lindsay? I have a note here, but will you also make a note so that we don't forget to add that?
Yes.
That'll be a fairly simple thing to do. And again, we do thank all of you. That's an incredible amount of work. And we're very proud of it. We're very, very proud of it. Okay, if there's no further discussion, can we get a motion to approve the letter as amended by Dr. Hall?
I would move that we approve the letter with the addition of a sentence thanking the staff for their hard work in preparing for this accreditation process.
Thank you. We do have a motion. Do we have a second?
I'll second.
Okay, seconded by Sarah L. Any further discussion? Okay, all those in favor, please say aye.
Aye.
Aye. Any opposed, please say nay. Hearing none, seeing none, that motion also passes. Okay. We're now going to hear Dr. Story is going to give us an overview and a progress update of the CHIP priorities and process. So Dr. Story, you're on.
Yes, thank you. And thank you for approving that letter. It means a lot to us. We're very grateful for you. This is going to be very quick. It will not take 10 minutes. I don't even have slides for this portion. I just wanted to update you on the county health improvement plan. Normally, you would have seen that probably for approval this month or next. We actually are pivoting a little bit with the way we want to do things. And for that reason, we are taking a little extra time. We did let the state know that we would be submitting it to the state by February 15th. So you will see it in the January meeting for approval. And we want that to really be, I don't know, kind of realized in a way that you will very clearly see what's our plan, what will progress look like, what will success look like. And we really want to make sure that we're doing right by the people who participated up to this point. So the CHIP team, Myra is, head of our health planning, who you met earlier in the study session, or you got to see again. And Amanda, who is like working our kind of CHIP coordination. They have been hard at work kind of reacting, and it's hard to come in as an executive director near the end of a CHIP process, that you kind of feel like, oh, maybe I won't, make changes, or you're kind of stuck with this for a minute. And it is the county's plan. It's not the health department plan. And so they were very gracious in allowing me some time to just kind of put my hands on it. And they've opened up that process for me, and I will talk more about that in the coming months. But the timeline is basically, today I can tell you that preliminary, the priority areas will be economic inequities, specifically around housing. That was number one. Probably no surprise, right? And that's housing of all types, right? That's not just like our unhoused neighbors, that's also affordability. Half of Jeffco is rent burdened, half of renters in Jeffco are rent burdened, like actually, statistically speaking. So there's a lot more around the data that we can dig into to kind of make the case for these things, and housing is one of those spaces. And that, and going hand in hand with that, and jobs and food security. So that's kind of one bucket. The second bucket being really environmental justice and climate change, and Jeffco being so well positioned to be a leader in that space that, climate change isn't something that people on the day-to-day are talking about, thinking about. It's not salient in the moment, but we know that we are like poised to be change makers in that space, just given the natural blessings we have here, and the responsibility to protect that is something we take very, very seriously, as does the county and our county commissioners as well, because this is, again, a county plan. We're just the stewards of it. Like, we're conveners, but it's not our plan as a health department. And then the third bucket is substance use disorder / mental health / suicide prevention. So that's kind of like, if you think of those three buckets, you can understand how those are going to look different depending on what part of the county you're in. So really what we're gearing up for is a whole new way of doing engagement in like micro places. So we are not here to say, here's our policy agenda, here are all the things we're going to do for the whole county. Yeah, we're going to present that. Kelly's going to talk a lot about that in her next portion of the meeting. But really, it's about engaging kind of these anchor institutions all over the county in a really systematic, thoughtful way. And I won't say more, because then I'll just talk for another hour, but like, we have ideas and we have plans, and this is going to be really exciting, and it will be unlike anything we've done before. And so there's a bunch of us here kind of like working on this, scheming on this. If you have questions about what that might look like, or you have ideas, I don't want to give too much away right now before it's kind of fully actualized for you, but you will be the first to know about our approach, and we are working with our friends nationally. We have a lot of like really great inspirational partners nationally, other health departments who have taken on chips that actually are hyper local in their solutions. And they've been very forthcoming and helpful and supportive because we're kind of gearing up to do something new. So those are the priority areas generally. Happy to take questions about that. I don't think they'll come as a surprise. You have all been part of this process. You took the surveys. Thank you for doing that. Like, so I'm happy to answer any sort of clarifications you might need at this point, before Kelly comes in with the main course of this section, which I got a sneak peek and it's really great. So again, open it up to the board and see if there's any feedback there on the little bit that I gave. But thank you for everything you've done thus far to support us in developing this plan with our partners.
One of the questions I have, question, comment, whatever category you want to put it in. I've always been very thankful that they've had the opioid, that big opioid, trying to get their arms wrapped around it. But we all know now that it's not just opioids. It's meth has raised its head terribly. And the fentanyl is now in everything. So is the conversation going to be a little broader than just the opioid? I'm hoping. And I again would stress that I'm hoping they will also include the alcohol. I do see Max, you're on.
Oh, Max,
you're on.
Max has a whole section later. Max has his own section this time. Are you so excited? We're all so excited that Max gets to present things. Yeah, so Jody and Max, right, are both, their videos are both on. And as you know, and I'll talk about in my updates later, we've really like leaned into clinic operational excellence. And with that comes a really broader understanding of substance use disorder. And again, going back to this hyper-local frame of mind, it really hit me one day as I was like looking out my window. I was looking at this map that I have up behind me, and I thought, Evergreen's housing problems are completely different than Lakewood's housing problems. There are people in Evergreen working on housing. Let's get to know them. Let's go to their meetings, and let's actually take this really more of a campaign organization approach with existing organizations that are doing good work, support them as we can, have grant mechanisms, track progress, and it really is about developing local stories related to, in some places, it's still opioid overprescription, diversion, right? That's a big problem in like the youth of unincorporated Southern Jefferson County. That's where I live, right? So it's like, that is kind of like a thing parents are talking about that they're nervous about. If I go 3 blocks this way, right, Colfax and Wadsworth, that's a whole different story. And that's where, Points West, our internal harm reduction team, we're working the streets, doing street medicine and street harm reduction. That looks very different than what's happening in Conifer, right? And our commissioners are actually a huge inspiration for this because they've got their constituents coming to them saying like, yeah, housing looks like this. And they're like, well, what do we do about that? I'm like, well, okay, let's figure it out together and let's make sure that they have some ownership over the chip as well. So that's also part of this angle. And one group's talking about opioids and a whole nother group is talking about meth. And then a whole another group's talking about xylazine, right? Which is there's always going to be something new that we have to keep our ear to the ground, knowing like what's coming. So it is broad. But we want to be specific at the same time with like our agenda as a county.
What do they, or do they, I say they, just of all the people working on this, because it's huge. How do they kind of look to see what other best practices other states are doing? I always found it was always wonderful when I didn't have to completely reinvent the wheel. And NCSL is such a huge, huge support and help. I don't know if they use NCSL or if they just try to figure everything out locally, but you get a lot of good ideas what the other states have found that work. And I know, Harriet, you've probably very tuned into NCSL.
Harriet's got her hand up, and I see Max grinning because I think he is thinking kind of along the same lines as you, Sherry.
Oh, good. Harriet, did you have a comment? And then Max, I wanted to hear from you.
Yeah, my comment's more general than that, but I just want to say that I'm thrilled to hear the 3 priorities because we've managed to hit 3 things that I'm totally passionate about, and probably the 3 things that I'm most passionate about right now. So I'm just thrilled to hear that, and you go in any way I can help in any of them. I'm there.
Thank you, Harriet.
Thank you, Harriet. Max, did you have a comment?
I just wanted to kind of touch on that, especially because you were talking about concerns around fentanyl and xylazine and how are we don't exist on an island by any means in our harm reduction for the community. We have, first of all, we're very lucky. We have what I consider to be the best team of harm reductionists in the States. I am very biased on that, but they show up not just with a wealth of knowledge, but these built-in networks of people across Canada and across the US to say, what is best practice? What's coming our way? Because it doesn't tend to travel by plane, it tends to travel by ground, so we can kind of get ahead and see what's coming down the pike. So we have not just one great solid resource, it's an amalgamation of multiple resources across a couple different countries where we're able to bring the best harm reduction experts. I also go out of my way to try and engage with law enforcement as well to see what they're seeing and see what concerns I can kind of get ahead of and plan around. And I also have been working with our amazing providers and nurses here to build partnerships in health systems in the state and outside to see like what are they doing for wound care management, things like that. So we have an extremely strong team of people that are putting themselves in positions to forward think about not just what we're dealing with now, but what's up ahead so that we can get ahead of it for best outcomes in the community. So a lot of resources going into it, a lot of partnerships. Yes, very much not just existing on an island, but I wanted to call that out in the ongoing work that they're putting in every week out here. So
thank you, Max.
Of course.
That's good to hear. Julie, did you have something that you wanted to add to that?
I think I just got excited when Dr. Story was talking about the health improvement plan and accidentally hit my camera. So
okay. That's okay.
Then he was like, well, now I'm committed. So I guess I have to be here. Thank you, Jody. And like Jody deserves a lot of credit for the fact that like I have a new idea every 2 days, right? I'm like, okay, Jody, what if we did this? What if we, and so thank you to Jody and to Max and all of the senior leadership team, because the CHIP I feel such a kinship to a CHIP just because I know that it can be a convening force for this county. It really, really can, but it's really got to sing to the people in the mountains and the people down here. And when we think about Jefferson County, it's like, oh, that affluent county. And in doing my research, there are 9,000 children in poverty, like abject under the federal poverty line, poverty in this county, like 60,000 people and like 9,000 kids. And I'm just like, it's crazy to me. Our suicide rate is like 3 times our peers. Like, so there are clearly challenges, but the tagline in my head for the CHIP right now, I haven't like workshopped this. So it really is like those challenges are local. Solutions need to be locally mobilized. They need to be owned by the community and community co-created. But again, there's networks of people already working on this stuff. How can they see themselves in this plan that we report to you and we will report to the commissioners and the county manager as well, and just make sure that they see this is their plan too, not just ours. So that's it. I said I wasn't going to take a lot of time, but I clearly got very excited about the CHIP because I think it's just such a great tool for storytelling, really, around public health. So you will see more about the CHIP in the next part of this, and I will kind of tee Kelly up. Then Sherry, you can get us kicked off with her. But Kelly has put together a really great proposal for like a way of doing public policy through the board that I think is going to streamline things and allow us to accelerate our CHIP goals even quicker. And then while also crosswalking some priorities that you may have, CALFO, California Public Health Association, there's a lot of different moving parts here. And so Kelly's done such a great job of bringing that in a way that's very manageable to the board. So I will kick it back to you, Sherry, and then Kelly as well. And I'll see you in a second.
Thank you. And I see that Kelly Curl has turned her video on, and you are actually, as you know, up on the agenda for the next little bit of time for the proposed 2024 public health policy priorities. Kelly, why don't you take it from here?
Yes, and let me reteach myself how to share my screen on Zoom. Are you seeing the full slide or the presenter
There you go.
version?
Now we got it.
Yeah. Yes, I did it on the first try. That makes me so happy. Hello, everyone. It's great to see you all again. I appreciate you giving me some time in your meeting this afternoon. I appreciate Dr. Story and Max and everyone else kind of teeing this up because they are heavily related by design. So this afternoon, I'm excited to share with you our proposed public health policy priorities that will guide our policy efforts in 2024. The goal today is to review the proposal with you all, take questions, take some feedback, and then I will also be connecting with you all individually between this meeting and your December meeting to get any additional questions or feedback that comes up after our time together this afternoon. And then bring a refined set of priorities to you during the December meeting for a vote for your approval on our priorities to guide us and our policy work for 2024. So some quick background on how we got here. As you all know, have seen, we now have our policy roadmap that's guiding how we are strategically advancing policy as a function area at JCPH with the goal of building our capacity to both plan for and effectively respond to policy opportunities to protect and improve public health in Jeffco. This is building off of a long history of policy success and leadership, including recent investments by the department of dedicated resources to working on policy that isn't restricted to a specific health issue area or health outcome. So we are continuing to be a leader across the state and frankly across the country in building out this capacity at the organization. Right now, we're looking at building on this foundation by adopting an intentionally designed policy agenda that ensures that the foundation that we have and the resources available to us are strategically used to advance our community-driven priorities across efforts not only like our county health improvement plan, but also the existing work that our department engages in across all levels of the organization so that we're maximizing every possible opportunity to advance these priorities. And it also helps to provide that level of transparency and accountability, both internally to ourselves, what we're holding ourselves accountable to, as well as to be transparent and accountable to our external partners, to you all as our board, our policy leaders, as well as other key stakeholders and audiences across the county as well. Before I get into our policy priorities, I'll preface, we're looking at all of this through an equity and ethical lens. So we've developed what we're calling our policy principles and our policy commitments. Our principles are the foundational lenses we use to evaluate, develop, analyze policies. They're the outcomes that we want to see as a result of public health policy efforts. So things like health and safety, promoting dignity and respect, and achieving health equity and justice and reducing disparities. Our policy commitments are more focused on the how of how policy comes to pass. Both our own role in it and what we would expect of others who are leading a policy process. And for that, we really want to see efforts being conducted in such a way that we are building and maintaining trust in our communities and with our various stakeholders and audiences, that we are centering community voices in our policy decisions, particularly those voices that aren't present or who are underrepresented where these decisions get made, and that we are focused on changing the systems that impact positively or negatively public health across the county. So to formulate our priorities, as Dr. Story mentioned in her update on the county health improvement plan, we've leaned heavily on the county health assessment process. As you know, we've pulled together not only quantitative data that's available to tell us a bit more about the health of the county, but we also worked closely with